Good evening, everyone. Welcome to Cape Cod Healthcare's Heart Health event for the February Heart Health Month. So we are featuring top 10 food strategies to reduce your heart disease risk. Discussion that I'm hoping to share. That will be something you can put into use to take care of your heart health as well as your families and friends. So I will be covering this probably in the next 20 minutes, this discussion, and then we'll have time for question and answers. My name is Kumara Sidhartha. I'm a physician and I work for Cape Cod Healthcare. I've been working with patients for nearly 21 years on Cape Cod and worked with patients on nutrition and heart health and their overall health. So we will be sharing what does the science say about preventing heart disease through nutrition in the next 20 minutes or so. And when you have any questions, just a reminder that you could type in the questions in the chat box, and we'll get to the questions at the end of the slide presentation. So today, this is the outline. We'll be looking at 10 strategies. The first one is looking at protecting the nitric oxide on-demand system in the arteries. It's about protecting the arteries in general, and I will indeed explain that in the slide. Looking at the gut microbiome, how do we nurture the good bacteria in the gut, and what's the connection for heart health? We'll look at that. Long-term inflammation, it has a key role in heart health. And so we'll look at how we can minimize the sources that produce inflammation in the body long term, and also how can we counter it with anti-inflammatory food. We'll look at cholesterol, what exactly happens when the cholesterol is building up in the system, and also we'll look at blood pressure. There is a lot of these cholesterol and high blood pressure is a very common scenario that we hear about, but I think there is still a lack of clarity of correctly understanding why it happens and what's the connection to the food. So we'll touch on those things. We'll look at antioxidants and looking at how blood sugar, diabetes, pre-diabetes like situations where there is excess insulin, and how that connects to heart health or worsening of heart health. We'll look at that. And a little bit on looking at the importance of chewing the food and social connections. So the first one is called the nitric oxide on-demand system. So what it means really is that we have arteries that bring in oxygenated blood to all the organs, including the heart, for it to function. And the way the amount of oxygen that is brought into the tissue, to the heart, the amount of blood that is brought in is controlled by the diameter, the girth of the arteries, right? How much blood can be brought in can be controlled by the diameter, the girth of it. So the arteries have an ingenious system. The lining of the arteries called endothelium, technically, that lining has cells that produce a particular type of chemical called nitric oxide. And that nitric oxide has the ability to open up the arteries to allow more blood to come in. So imagine you or your neighbor or your friend is doing something that increases the demand of blood flow in the heart. Let's say shoveling. Recently we had a snow, and if somebody is shoveling, that means they are demanding, the heart rate goes up. When the heart rate goes up, there is an extra need for the blood flow to come and nourish the muscles of the heart with oxygen to pump more often, right? To supply the blood that is necessary for the muscles of the hands to shovel. So that extra demand that is placed on the need for oxygen, that requires that the arteries open up and allow more blood to flow in to bring the more oxygen that is needed. and immediately during that time, the lining of the arteries release more nitric oxide that allows for more blood to come in. Now, so that's when a perfectly normal system and a normal heart that happens. But when there is in our regular meals, when there is excess fats and oils, any type of oil, that affects the lining of the arteries, so that this on-demand nitric oxide system that is so essential to allow for more blood flow, more oxygen, gets impacted. So minimizing fats in general, high fat diets, and minimizing oil, all types of oil is key here. Looking at the second strategy is about nurturing the gut microbiome. What do I mean by that is the good bacteria, the friendly bacteria in the gut. They play a key role in many aspects of our health, including heart health. How? They can govern how much inflammation we will have in our system overall. And having more inflammation is a higher risk for heart disease, as well as other long-term diseases like diabetes and cancer. So the other area the good bacteria help us is by making sure that when a person eats animal food, animal protein foods, especially those that have L-carnitine or choline as nutrients in them, that the body doesn't break it down into harmful substances that can create blocked arteries. So there is a fancy name for it, trimethylamine N oxide, shortly TMAO. So we will stick to that short term. And that excess levels of TMAO can lead to strokes and heart attacks. And the way we have healthy bacteria can minimize the production of this TMAO in our bodies. That way, we don't get the heart attacks and strokes. So how do we make sure we have enough healthy bacteria in order to kind of coordinate all of this? Is by eating foods that has dietary fiber in them. So generally, it's leafy greens like the ones that are displayed here, vegetables like the ones that are displayed, certain fruits, whole grains like the oats and the whole wheat pasta that is displayed here. So these are ways, and then the beans that you see in the can. So the beans and lentils, leafy greens, vegetables, these are key to add dietary fiber. That way we can help the healthy bacteria. Number 3 is looking at how do we shut off long-term inflammation. So inflammation is generally how the body reacts to any kind of an insult or an injury. If you think about somebody who has a bronchitis, right, a viral bronchitis, the virus is the insult. The body is reacting with the lungs, and the tubes in the lungs are getting inflamed, swollen, and that's bronchitis. That's inflammation. If somebody gets arthritis due to injury during sports when they were young, then that is another way the body is reacting with inflammation. So inflammation is generally a reaction from the body to an insult. And in this case, when our food choices are not healthy enough, that becomes the insult that triggers the long-term inflammation. And this goes on for months and years, slowly building up, and that can lead to changes in the lining of the arteries that I mentioned earlier, to start to have the blockage building up in the arteries. And similarly, this kind of an inflammation is also leading to high blood pressure. So when somebody has high blood pressure, the heart has to work harder to pump against that pressure. So all of this comes into the picture of inflammation when it's high, how this can be affected. Also, depending upon the foods that we're eating, the lining of the gut can be affected as well. And when that lining of the gut is affected, that leads to a particular, and the bacteria can release a substance called lipopolysaccharides, LPS. Shortly, we'll stick to short forms here. The LPS can also increase inflammation in the body. So the other piece is to make sure that there is a type of fat that is immediately surrounding our intestines called visceral fat. making sure that we keep the amount of visceral fat to the minimum or absent is going to be a key way to reduce inflammation, because the visceral fat is like a factory that produces inflammation. So how do we shrink the visceral fat? Is making sure that by making sure we don't get in excess calories going into our meals. So choosing foods that are high in nutrients and not calories. For example, the greens that you see on that end, the vegetables that you see are on the spectrum. They have the highest nutrients and the lowest calories. So that's an example of how to reduce excess calories to shrink the visceral fat to reduce the inflammation. And then the other way is to kind of reduce the amount of injury to the lining of the gut is by minimizing high fat meals, high sugar products that can injure the lining of the gut. So this way we can shut off the sources of inflammation. We can also, once the inflammation is built and it's floating in our system, we can also use food to counter that inflammation that is there. Foods that are high in omega-3 fats are known to have an anti-inflammatory effect. And one of the efficient ways to get omega-3 in our system is by using flax powder, flax meal. We have that displayed here as well. It comes in seeds, but eating the flax as seeds is not useful for our system. It has to be ground. So the ground flax seeds, or the flax meal, provides not only omega-3 fats, but it also gives dietary fiber, which we just talked about, being healthy for the gut bacteria and the heart. And also it gives other lignans and other substances that are also anti-cancer. So, today's discussion is not about cancer, but it also has a variety of benefits. So ground flax, nuts like walnuts, that has omega-3, and leafy greens in general have a small amount of omega-3, not as much, but they are also a good addition in the mix of meals to add to more omega-3 for an anti-inflammatory effect. We need to talk about high cholesterol. I think the way to understand cholesterol is we need a little bit of cholesterol in our body to make hormones. So cholesterol is like a raw material for many of the hormones that the body makes. So we're not aiming for a zero cholesterol situation. That's not a good thing, right? So we need a little bit of cholesterol. But when we have an excess cholesterol buildup, that's where the problem comes for the arteries, where the blockage builds up. Body has a very smart way of making sure that cholesterol levels don't become too much in the circulation. The way it does that is at a gut level. So whenever the food comes in and it has high fats and high cholesterol coming in, based on the digestive breakdown, whatever digestion produces as these fatty molecules, the gut bacteria in the gut has a way of eliminating that excess cholesterol out through your gut, through the stools. It does that by producing a special type of bile acid called secondary bile acids. This is not the regular bile acids that we know of. These are secondary bile acids that is produced by the gut bacteria, the friendly bacteria, by working with the dietary fiber that we eat. And the secondary bile acids helps to exit the excess cholesterol out through the stools and don't even let it get into the circulation, right? So that the blood level of cholesterol is not going up. Now, when the system is overwhelmed, when the food keeps coming in with high cholesterol and high fats, this secondary bile acid system gets overwhelmed, maxed out. And at that point, the body starts to pack away the excess cholesterol in the liver, and that's called fatty liver. So having fatty liver is a symptom, is a sign that really tells that this protective mechanism of bile acid exiting excess cholesterol is overwhelmed, maxed out, and body is resorting to the next best option of packing it in the liver. and then immediately the cholesterol is going to go up in the blood level. So again, going back to gut bacteria, dietary fiber is going to be helpful to allow for this excess cholesterol to be minimized in the bloodstream. We'll talk about kidneys. So anytime we talk about blood pressure, we need to remember that all of the action of blood pressure is happening in the kidneys. We usually associate it with heart. The effect of the blood pressure is on the heart, but the origin of the blood pressure is in the gut and in the kidneys. So what do I mean by that? In the kidneys, we have a sodium safety valve, which is similar to a pressure safety valve. When there's an excess pressure buildup, there's a safety valve that lets out the steam, right? So that the pressure is maintained at the same level. Similarly, the kidneys have the sodium safety valve in a way that whenever there is excess sodium building up in the bloodstream, kidneys as a way of letting out excess sodium in the urine so that the sodium levels are maintained at a steady state and the blood pressure is maintained at a steady state. And guess what? The gut bacteria, the dietary fiber comes into the picture again because they help this sodium safety valve in the kidneys. That way, the blood pressure can be avoided or controlled. And that way, the heart is not having to pump against this pressure. Antioxidants. You might have heard of antioxidants in the context of cancer, preventing cancer, but many may not know that antioxidants are also useful in preventing heart disease. So the oxidative stress, which is what the antioxidants are countering, right? Antioxidant. So the oxidative stress has been known to affect the lining of the arteries, the endothelium that I mentioned, the nitric oxide system. So having colorful fruits and vegetables like the one that are displayed here, leafy greens, they are all loaded with antioxidants. Cacao is loaded with antioxidants. So all of this is going to be, and some of the herbs and spices like turmeric, for example, has antioxidants in it. So all of this is going to be useful to, again, reduce the risk of heart disease, as well as reducing your risk of cancer as well. Insulin. So when it comes to diabetes and blood sugar and pre-diabetes, what helps to reduce the risk of diabetes also helps to reduce the risk of heart disease, because they both are connected. Anytime the blood sugar goes up in the system, the insulin levels, the body puts out more insulin to chase down the blood sugar. And anytime we have excess insulin floating in the system, then it is harmful to the arteries. So if we avoid having the need to have excess insulin in the bloodstream, then it's going to be healthy for the arteries. So what works for diabetes in terms of diets works for heart as well. So how do we minimize excess blood sugar? By paying attention to avoiding fats, sugars, and also the type of protein. Animal protein can create inflammation that can increase diabetes risk. So all three are important there. We're going to wrap up soon. This is a simple reminder that when we chew the food, especially leafy greens like those that are displayed there, carrots and things that are rich in the natural nitrates, that the saliva, once you start chewing the food, the saliva starts to work on it, right? And it breaks down these nitrates to eventually nitric oxide, which actually helps the arteries. So in a way, chewing is useful to make sure that we get enough nitric oxide, especially when we chew leafy greens, for example, vegetables. The other aspect of chewing is that when we juice the same foods, the molecules are changed in a way that the carbohydrates almost resemble sugar. So take an apple juice. Apple has fiber in it that comes with it. So it's a much better byproduct at the end of it than the juice itself. Apple juice still has some good stuff in it, some nutrients in it, but it's not as good as the package, the whole whole package, the apple. Similarly, kale, juicing kale compared to just chewing the kale. So chewing is always better in that sense. And then social connectedness, this is where we finish up here. Social connections have shown to help us in many regards in our health, in many aspects, including mortality, how long we'll live, including inflammation and how inflammation affects heart health and cancer. We just talked about it. So in general, social connections have a big role in improving our health. And so if we combine healthy food with social connections and get-togethers, that is a win-win for our heart health. So we will finish with that. Those are the top 10 strategies that we wanted to touch on. We are now opening up for QA. So if you had already typed in your questions, we can go over them now. And while I'm looking at the questions, you can also continue to type in them. So the question is, are some animal proteins less inflammatory than others? The answer is no. The reason is it's good to understand the makeup of the protein. All animal proteins are made of building blocks that are amino acids that have amino acids that are predominantly sulfur molecule containing. So sulfur dominant amino acids make up mostly an animal protein. Non-sulfur amino acids make up mostly plant protein. So that difference seems to have a difference in how these proteins behave in our physiology and how our body reacts to them. So because all animal protein have similar makeup in terms of the building blocks, being sulfur dominant, they all have the same effect. How important is yogurt for gut health? Not much. The way to improve gut health is to have dietary fiber. That is more important than the live cultures that are talked about in yogurt. It's the dietary fiber that creates the environment for the gut bacteria to thrive, and the yogurt has animal protein in it. So anyway, so it's more harm that way, and it also yogurt has zero dietary fiber, right? So in many ways, when you look at it, the better package for the gut bacteria and gut health is something that has dietary fiber, and that'll be leafy greens and vegetables. How much flax seed should we eat? Generally, flax powder, I recommend at least 2 tablespoons a day. Sometimes if you're not used to it, it can cause some bloating initially. So if you've never had flaxseed powder, you can start with half a tablespoon, and then after a couple of weeks, advance it to 1 tablespoon, and then after a couple of months, you can go to 2 tablespoons a day. That's the recommendation. Yeah, I mean, I would sprinkle the next second question was any suggestions for ways to incorporate flax into the diet. So you could sprinkle it in the salad. You can add it to your oats after you. So you can make it in different ways. And flax is a great way to swap out eggs in baking. They like the way eggs are used in baking to hold things together. Flax powder can be used to do the same job in baking as well. There are many ways. You can look up flax eggs, how to use flax for baking. You'll see that. Are walnuts the only healthy nut in terms of omega-3? Yes. In terms of omega-3 source, among the nuts, walnuts are healthy. Walnuts are the richest source. Among generally healthy nuts, a small amount of pistachios in one study, randomized controlled study, had shown that it can reduce the LDL cholesterol. So not from an omega-3 angle, but from another angle, pistachios in a small amount, like 2 tablespoons a day, not more than that, because then all these nuts have a higher calorie, they're calorically dense. So just a caution on the amount we use. So 1 to 2 tablespoons is more than enough. Do you recommend red yeast rice to lower cholesterol? I do not. I know there are some things about it in the media. I haven't had a need for it. When I work with patients with whole food plant-based meals, majority of the meals ingredients coming from plant foods, even if you're not doing 100% whole food plant-based, right? If most of your meals are more during the course of a week, many of your meals are having ingredients that have plant foods, whole foods, then you don't. I haven't had a need to recommend red yeast rice. So yeah, so those are questions. There is more coming here. Is olive oil a good fat? The answer is no. The studies have clearly shown that any oil, including olive oil, affects the nitric oxide system. So remember, we talked about the lining of the arteries that produces nitric oxide that allows for the arteries to open up when there is a demand for it. So the studies that test out different foods to see if those foods impact this system of nitric oxide from the lining of the arteries. These studies use a very simple test that can be done in any clinic. Like they raise the blood pressure cuff. The clinic should have ultrasound, a portable ultrasound. So they check the diameter of the artery in the arm before they check the blood pressure. So, and then they raise the cuff, the blood pressure cuff, the pressure raises, which cuts off the blood circulation, right? So we all feel the arm hurting when somebody raises the blood pressure. What you're feeling is that the blood circulation is getting reduced, which is the most powerful stimulant for the nitric oxide to be released. Anytime the nitric oxide system senses blood is not coming through, it triggers it like anything. So when the blood pressure cuff is released, the nitric oxide pours like anything in a normal artery. So immediately when we check the ultrasound again, the diameter now should have gone up, the artery should be wider now in a normal, healthy artery. So in these studies, what we do is, the researchers do is they give them a particular type of food, and they check this diameter before and after, and they find if the arteries are healthy. And when they do that test, olive oil fails that test, unfortunately. So yeah, so it does affect the artery. Are probiotics good for gut health? So if you're referring to probiotic capsules, we don't need to rely on them. Generally, fermented foods and all the foods we talked about today will be enough to have good bacteria. So sauerkraut and tempeh, which is a fermented soy, tempeh, sauerkraut, miso. These are things that I generally recommend, and kimchi, which is a spicy version of Korean version of fermented cabbage. Those are things that, along with that, if you have them, it doesn't have to be daily, but if they're part of the regular meals, and then if you're eating the foods that are displayed here, we generally don't need to use probiotic capsules. What is important to know about fermented foods? I think I just answered that question. Fermented foods are important for the gut bacteria, as I said. So that allows for the gut bacteria to flourish, and we have seen how vital a role these gut bacteria play in governing our inflammation, heart health, TMAO, high blood pressure, and how our weight is controlled. All of that is gut bacteria. So yeah. And what are your feelings on omega-3, 6 supplements? We don't need them as long as we're adding flax powder. The question asks about omega-3 and 6. So it's important to know that omega-6, we already eat too much omega-6 in our foods, especially with oils, baked goods. So the issue we have is the scarcity of omega-3 in the diet. we have enough omega-6 going. So it's the ratio should be like 1:1, a portion for omega-3 and omega-6. And there was a study that looked at national consumption of omega-3, omega-6. I think it was an old data 10 years ago, but it found that the ratio was 1:13. For every portion of omega-3, there were 13 portions of omega-6 that was being consumed on a national level per capita, right? So we got a lot to do with reducing the amount of oil and baked things that has omega-6, and to increase omega-3 through whole foods, which is our ground flax and leafy greens and walnuts. You don't need that much. It's like 2 tablespoons of omega-3. Could you speak to cooking without oil? So generally, cooking without oil, sauteing is generally done, and you can saute with water, or sometimes using other vinegar and things like that, but you don't have to stick to oil for that. There are online videos you should be able to look up in terms of how to cook without oil or saute without oil. If avoiding dairy and milk for heart health and cancer prevention, how can I ensure I get enough calcium for osteoporosis prevention? Good. So there is an assumption there in the question that we're going to need calcium. We're going to need dairy for calcium for bone health. So I just want to clarify that science is clearly now showing that for bone health, we need more than calcium. We need magnesium, we need vitamin K, and to supply the multitude of nutrients that are needed for bone health, the better way to go about is by using leafy greens and beans. So the leafy greens and the beans in the cans, that combination is one of the best ways to supply enough calcium, magnesium, and vitamin K that is required for bone health. So yes, that's kind of, there are other seeds like sesame seeds is another a good rich source of calcium. Dried figs or fresh figs, again, good source of calcium. So, and then when we reduce the animal foods in general, calcium is not lost in the urine because of how the animal foods can flip the acid pH in the system. So in many ways, we don't need as much calcium when we are minimizing the animal products. Do you recommend fish oil supplements? No, I do not. Just what we already discussed about it. Does sleep or exercise impact the gut? Good question. Exercise and gut health, I'm not seeing a direct connection there, but definitely sleep has a big role. Sleeping stimulates one of our nervous system that is part of our automatic nervous system called vagus nerve. So it is important and the vagus nerve controls many systems, or gut health, digestion, heart health. So since sleep impacts vagus nerve, that in turn has an effect on our gut health and our heart rate and so forth. So good sleep is important in that sense. How can I eat enough fruits and vegetables if they give me indigestion? So if somebody has a gut specific question, sometimes you have to tailor these recommendations to your needs by talking to a professional, a dietitian, who actually can go through more questions, which I cannot individually ask now in a camera. So I would recommend just approaching a professional for that. But I can give you an answer saying start low and build up slowly, because if your gut is not used to a lot of fiber coming in to your meals, then you may not have enough good bacteria to handle it. So historically, if not eating enough fiber, Suddenly, when we introduce a lot of vegetables and leafy greens and beans, that we haven't set the stage with with the good bacteria to handle that. So we're going to have a bloating and indigestion happening at that time. So if we start low, build up slowly, it gives some chance for the good bacteria to develop and then handle that fiber coming in, and then it's a better match. So that'll be my recommendation to start like that. And cooking the vegetables kind of takes away that pressure a little bit too, and digestion is easier that way. Does the flaxseed need to be organic? And they don't have to be. And any preferred brands, I usually stay away from recommending brands in this kind of talks. So yeah. Yeah, more questions. Okay, what can be substituted for oil in cooking? So people are, there's a lot of questions about oil. Again, it depends upon what cooking we're talking about. Sauteing, you can do it with water. Some people use cooking wine as well. So those are the ways to kind of approach it. There are videos to look at, and there are, if somebody has, a significant risk for heart attack or heart risk, minimizing or avoiding oil is an important strategy. So I think these questions are valuable, even though there are more questions on this oil. So I would definitely encourage you to look at that. Do Brazil nuts lower cholesterol? No, not that I've seen data-wise. Brazil nuts are a very good source of selenium, and Brazil nuts are very high source of selenium that you can actually get a toxic level of selenium in your body. So the recommendation that I gave is Brazil nuts, either 2 or 3 a day, and not more than that. And that selenium is important for your thyroid health. And thyroid hormone indirectly has a role in our cholesterol levels. So, we can make a stretch and say, yeah, selenium, Brazil nuts has a role in cholesterol through thyroid health, but not a direct connection though. It's usually omega-3 from walnuts, and pistachios a little bit helps. If incorporating these changes, does it help cleanse the arteries over time? So yeah, so it's not only preventing heart disease. You can actually, if somebody has an established blockage, you had an angiogram, cath done, they showed 40% blockage, 50% blockage, 90% blockage, right? Whatever that is, we can reverse. The studies are now showing that we can actually dissolve those blockages by using the regimen that we talked about, but clearly no oil in that regimen. It's a strict regimen of using leafy greens that you see on that end, a lot of it, vegetables, fruits, whole grains, beans, and a small amount of nuts, or seeds are better than nuts in that sense, even because of the kind of the fat content. So very little nuts, if at all, and also avocado. Caution with avocados as well. If we are trying to reverse blockage, it's a stricter regimen, and that it definitely, many of these ingredients helps there. Caution on the amount of nuts, and definitely avocados can be high fats in that sense. So I think we're wrapping up here. Thank you for all the questions. You've been a very engaged audience, clearly, based on these questions. Again, a reminder that you can go to Cape Cod Health website, the capecodhealth.org/heart, and that'll have this recording of this video in a week from now. It has also all our other information, the other initiatives and programs that we have related to our heart health program regarding this month, Heart Health Month. You can check that on the website as well. And you can continue to send your questions. If you have questions that you could not get in this period, send your questions to outreach at capecodhealth.org. So outreach at capecodhealth.org. You can continue to send questions. We'll respond back to you. And with that, we're closing. Thank you very much for your participation. I wish you the best with trying to incorporate some of these recommendations we talked about. If you're already doing these changes, excellent. Keep up the good work, and best wishes for your heart health and general health going forward. All the best, and thank you.